So what is an ACE and why should you care? ACEs stands for Adverse Childhood Experiences. Why should we be talking about childhood trauma? Well, childhood trauma is a leading indicator for suicide and self-harm. There's 10 items that we use commonly in research and in clinical practice to look at what is ACEs. So it's any type of adversity that happens before the age of 18. It really covers anything from emotional abuse and bullying, physical abuse or violence, sexual abuse, emotional neglect, housing or food insecurity, a parent that's separated or divorced, domestic violence, a parent imprisoned, and a household member with a mental health disorder or a problem with drugs and alcohol. There is what we call a dose-response relationship. So that means the higher number of ACEs that you have, the poorer health outcomes you have across your life. An individual with an ACE score of 6 or more has a 4,600% increase in the likelihood of later using intravenous drugs. An individual with an ACE score of 4 or more is 460% more likely to be depressed and 1,220% increase in attempted suicide. If you had a certain level of ACE scores, it impacted not only your mental health, but you had much higher rates of cardiovascular events, diabetes, and cancer. It doesn't stop in childhood. ACEs are common. About 64% of the population has at least one ACE. 17% has 4 or more ACEs. What do we think is the rate in the military? I don't have data to prove it. It's anecdotal. There's been a few people who have done some pilot programs. When I talk with people in the military, 50, 60% is what they say. And this is among enlisted personnel.